Hey, thanks for joining Dr. Simone and I for a chat. We're talking about coughs and colds. It's that time of the year where you need to get your sanitizer, you need to stock up on tissues. So how can we, I guess, look after our families during this time and kind of prevent these things from happening, if we can?
Well, look, there are things that we can do to minimise the risk. It's hard to prevent.
Totally.
Until children are of a certain age, which is normally around about, well, I joke and say 18,
Right.
but maybe sort of 10 or 12, where they can reliably cover their mouths when they cough,
Yes.
and then reliably wash their hands afterwards. These things are going to spread. So if you get kids together at preschool, at
Yes.
playgroup, at school, then these things are going to happen, and we just need to find ways to minimise the risk. So
Okay.
coughs and colds are things that, runny noses, obviously a cough. Sometimes those coughs can interrupt sleep, and sometimes they can progress to things like ear infections or throat infections or those sorts of things.
When should we look at maybe taking our children to the doctor and getting them checked up? Because some parents would say, oh, they've just got a runny nose, they're fine, or they've got a cough. But should we be, more vigilant when we see these first instances happening with our children?
So the first thing I'll say is trust your parent gut. If your kid is seriously unwell, if they are floppy or lethargic, if they have a high temperature, if they're not producing as much urine as they would normally do, so if they're in nappies and their nappies are so dry, or they're not drinking much fluid, then those are things that, regardless of how long they've been sick for, get them checked out. They are seek help now things.
Okay.
If your kid is, for the most part, a bit cranky, but for the most part okay, then active, interested in playing with their toys or watching a favourite TV show or something like that, then we can generally manage that with keeping their temperature down, keeping their fluids up.
So would you say give them some Panadol and Nurofen?
Absolutely. I
check their temperature
Check
first?
their temperature first. If they have a temperature but they're mostly okay and eating and drinking and not waking up in the middle of the night coughing and vomiting, then give them some Panadol. That brings their temperature down, it allows them to sleep, it allows them to rest better, and that helps them to get better. If you get to around about day 2 or 3 and they're not showing signs of improvement, then that's the time to get it checked out.
Right, because it could be develop into an infection.
That's exactly right. So we could be going from a virus that the body is going to sort out on its own into a bacterial infection that might need a little bit of extra help there. One of my little secret weapons that I often recommend to my patients is that if your kid is unwell, and if they're over around about 12 months of age, then they can really benefit from some liquid zinc supplementation, because that's a really good way of helping to boost the immune system, and it comes in pleasant vanilla flavours.
So should we be getting these multivitamins, these zinc things, prior to this season upon us? Or
I reckon it's good to have a stash at home, and that way you know what you need to call on when your kid's unwell.
Great. Thank you so much, Dr. Simone. So there you have it, some great tips that may prevent your child from getting coughs and colds this season.